Imagine a silent invader, capable of hiding deep within your lungs, spreading quietly from one person to another with just a single cough or sneeze. Tuberculosis and other mycobacterial infections can lurk undetected, posing a serious risk to both individuals and communities. So, how do doctors swiftly uncover these invisible threats before they cause further harm? The answer lies in a powerful group of diagnostic tools known as Acid-Fast Bacillus, or AFB tests. Acid-Fast Bacillus refers to a category of bacteria, most notably Mycobacterium tuberculosis, the culprit behind tuberculosis, as well as other mycobacterial infections like leprosy. These bacteria are called acid-fast because of their unique cell wall, which makes them resistant to certain dyes and chemicals. This property is harnessed in the laboratory to distinguish them from other bacteria, forming the cornerstone of AFB testing. When a patient shows signs and symptoms suggestive of active tuberculosis, such as a persistent cough lasting more than 3 weeks, coughing up blood or thick mucus, chest pain, fever, chills, night sweats, unexplained weight loss, or fatigue, doctors may order a series of AFB tests. These tests are also crucial for people at higher risk of TB, including those with weakened immune systems due to HIV, diabetes, organ transplants, or certain medications, as well as those who have recently been in contact with a person diagnosed with TB, or who live in settings where TB is more prevalent. The main goal of AFB testing is simple yet vital: to detect the presence of acid-fast bacteria in a patient's sputum, the thick mucus coughed up from the lungs. Unlike saliva, sputum originates from deep within the respiratory tract, where TB bacteria tend to multiply. There are 4 primary types of AFB tests, each with its own purpose and timeline. The first is the AFB smear. This is a rapid test where a sample of sputum is spread onto a glass slide, stained and examined under a microscope. If acid-fast bacilli are present, they stand out, allowing laboratory specialists to see a possible infection within just 1 or 2 days. However, while a positive smear suggests the likelihood of TB or another mycobacterial infection, it cannot provide a definite diagnosis by itself. For a firm diagnosis, the AFB culture is employed. Here, the sputum sample is placed in a special medium and allowed to incubate, giving any mycobacteria present the chance to grow and multiply. This process takes longer, often between 6 to 8 weeks, because these bacteria grow slowly. Nevertheless, the culture is considered the gold standard, as it can confirm the presence of Mycobacterium tuberculosis or related bacteria with certainty. In recent years, technology has added another powerful weapon to the diagnostic arsenal: the molecular test, specifically called nucleic acid amplification tests, or NAATs. These tests can detect the genetic material of TB bacteria directly from the sputum sample, often delivering results in less than 2 hours. Not only can NAATs identify TB bacteria rapidly, but they can also determine if the bacteria are resistant to rifampicin, one of the key antibiotics used in TB treatment. This is crucial, as drug-resistant TB requires specialized therapies. In addition to these tests, a susceptibility test may be ordered alongside the AFB culture. This test helps doctors determine which antibiotics will be most effective against the specific bacteria in the patient's body. Since Mycobacterium tuberculosis can sometimes be resistant to standard treatments, knowing which drugs will work is essential for crafting a successful treatment plan. AFB tests serve several important roles in patient care. Primarily, they are used to diagnose active tuberculosis infection, ensuring that those who are sick receive prompt and appropriate treatment. They are also used to diagnose other acid-fast mycobacterial infections, such as leprosy or infections caused by Mycobacterium avium, which are more common in people with weakened immune systems, including those living with HIV. For individuals already diagnosed with TB, AFB tests are repeated during and after treatment. This helps healthcare providers determine if the prescribed therapy is working and whether the patient is still contagious. If the bacteria are no longer found in the sputum, it often means the infection is under control. and the risk of spreading TB to others has decreased. So, what exactly happens when an AFB test is ordered? The process usually begins with the collection of a sputum sample. The patient is asked to take a deep breath and cough forcefully to bring up mucus from the lungs, which is then collected in a sterile container. Sometimes multiple samples are collected over several days to increase the chances of detecting the bacteria. In certain cases, if a patient is unable to produce sputum naturally, a healthcare provider may use special techniques to help induce coughing or collect the sample. Once the sample reaches the laboratory, it undergoes one or more of the AFB tests described earlier: smear, culture, molecular testing, and possibly drug susceptibility testing. Each of these tests plays a unique role, combining speed, accuracy, and essential information about the bacteria's characteristics. AFB testing is not only critical for individual diagnosis and treatment, but also for public health. Detecting and treating active TB promptly helps stop its spread, protecting families, workplaces, and communities from this potentially deadly disease. To sum up, Acid-Fast Bacillus tests are indispensable tools in the fight against tuberculosis and other serious mycobacterial diseases. They empower doctors to identify infections early, tailor treatments to each patient's needs, and monitor progress over time. As medical science advances, AFB testing continues to evolve, offering hope for more rapid, accurate, and effective diagnosis and care, helping to ensure that the silent invaders are found and stopped before they can do more harm.